Good morning, everyone. So I am with the next video of next 5 pages of the therapeutic guideline. So before I start, I just want to share a few things with you. The reason why I started with this book is because you all know that this book is very, very important, and every word, every line, it is very important to answer many questions that they will ask you. Okay, so slowly and gradually we will cover all the topics which comes in exam and which are very important, and which is the normally the patient comes with the complaint. These are all the normal topics that we always get. So okay, so without wasting time, we will start today's session. Okay, so with the over prescribing and under prescribing, it is not good. So, like, with this exam, try to be more conscious while you are prescribing any drug to the patient, even it is painkiller or even it is antimicrobial. Okay, so it is very important. You need to know which drug to prescribe, when to prescribe, and how long you should give the prescription for. Okay, because it is important that the dose, duration of treatment, and quantity of drugs prescribed are correct and clearly stated on the prescription. It should be written on your prescription that how many days that the patient needs to take the drug and how many times. Overprescribing is wasteful, can cause unnecessary adverse effects, and increase the opportunity for overdose. Of particular concerns are drugs that cause dependence or are prone to abuse. It means that the drugs of dependence, for example, opiates or the benzodiazepines, and drugs that have a narrow therapeutic index. That is, the therapeutic dose is very close to the toxic dose. It means that even if you prescribe the small quantity which is higher than what is needed, these drugs can cause the damage. Okay, so for example, the codeines or the oxycodone, they have very narrow therapeutic index, but the Panadol, it has very broad therapeutic index. Even if you take a certain amount or certain number of tablets, it does not cause much harm. Okay, and over prescribing of antimicrobials can lead to, just be very careful while you are prescribing antimicrobials in Australia, because they do not like this thing, because they are very fussy about the antimicrobial resistance. Underprescribing is also wasteful and potentially harmful, particularly because it can result in ineffective treatment. Then, supporting authorities and the use of drugs. There are certain drugs that you should not be prescribing to the patient if he's an athlete. You can get more knowledge by opening this link here. Okay, and the other next thing is the referrals. You should always know when to refer and whom to refer, and there is a particular criteria how to do the referral. So we will be reading here. When referring a patient to another practitioner, like for example specialist or any his GP, you should always write written referral. Okay, the referral should outline the presenting what you need to write in that referral: the patient's oral or the chief complaint, whatever the suspected diagnosis you have, if you have any, and the relevant patient details, like why you are referring, the reason for the referral. The referral should be recorded in the patient's history. The referring clinician should ensure that the patient attends the appointment. For example, if you are referring the patient to the GP, you should ensure that the um, patient would a patient would present to that appointment with the specialist and communicate with the other clinician about the patient's condition. Likewise, if a medical practitioner, if his GP has referred to you, you should communicate and let him know like whatever is going on. Like for example, provide feedback to the medical practitioner in writing. Okay, and the clinical records should be kept in accordance with the DBA, which is the Dental Board of Australia guidelines. It is mainly if he is a kid, you should be keeping his documents until he's 25-year old, and if he's adult, then the records of every patient should be kept until 11 years. Dental treatment during pregnancy and breastfeeding. This is a very common dilemma that we always see in our clinics. Like whenever the patient she is pregnant, then she is very conscious about the treatment and mainly the X-rays. So here they have stated few things that we need to follow. Most dental treatment can be carried out safely during pregnancy. In general, the elective treatment is best performed in the second trimester of pregnancy. Elective treatment are like, for example, that they are not in emergency. Patient is not in pain. It's just the scheduled appointments. For example, the regular checkup and cleans, or the fillings, or other elective treatment that can wait. But you are, or the patient are looking for any cosmetic things. So you can do that, but they are best performed in the second trimester, which is the safe trimester. Elective procedures requiring general anesthesia or intravenous sedation should be deferred until after the birth, and preferably until after breastfeeding has stopped. If the patient is unsure if she is pregnant, defer treatment decisions until pregnancy status is known. And if IUPA are necessary for assessment or diagnosis of infection or trauma, there is no reason on radiation protection grounds to defer them. It means that you can safely take every IUPA. It's totally safe. And according to ADVANSA guidelines, state that IUPA are not contraindicated during pregnancy. However, a ladder drape is recommended when the X-ray beam is directed downwards towards the patient's trunk. For example, if you are taking occlusal view of the maxilla, you are taking occlusal radiograph, then the beam should be going towards the patient's trunk, right? So in that case, you can put the ladder drape on the patient's trunk. For information on the use of drugs during pregnancy and breastfeeding, see Appendix 1. So, we will be reading all the drugs that you can prescribe in pregnancy and breastfeeding, or you should not. It is in the Appendix 1, which is towards the end of this book. So, we will read that. Then we are going ahead with the dental prescriptions and prescription writing. You should know like how to write a prescription for the patient. Overview of legislation about prescriptions and prescribing. The information included in this topic is appropriate for dental practice only and may not be applicable to other areas of medicine. For legislation pertaining to obtaining, possessing, prescribing, supplying, or administering drugs in each of the states and territories, dentists should follow the appropriate legislation for their state or territory. Overall, the requirements for what constitute a legal prescription does not vary significantly between the states and territory. Like there is certain pattern how you need to write the prescription. It is same for every state. For example, be it Victoria or Sydney or Canberra, it's completely same. But there are certain other rules and regulation which can vary within the states, and you should be aware about that. Dentists may prescribe prescription only medicines and drugs available over the counter, provided the drug is for the dental treatment of a patient under their care and the prescription complies with the relevant states or territory legal requirement. You should always prescribe the drugs, give the prescription to the patient who is under your care, like who you have seen that patient and you know that the need really exists. You should write a prescription for him, and the prescription is only for the dental treatment. Do not write for anything else, like any medical cause or any other thing. Prescriptions must be written for use by only the person named on the prescription. A prescription must not be written under a patient's name to obtain a stock for use in the presence on multiple patients. Like, for example, if you are prescribing a drug to the patient, only that patient should be taking that drug, not for the stock. Additional caution should be exercised when prescribing drugs of dependence, for example, because you should be very, very conscious while you are prescribing the drugs of dependence, because that can cause harm to patient's body. Okay, and dentists should be aware of the relevant legislation for their state or territory pertaining to prescribing drugs of dependence. Drugs of dependence include some schedule for, like they have divided the drugs into certain categories and schedules, where they have written like the schedule 4 drugs, which are mainly the benzodiazepines, and schedule A drugs. These are very abusive drugs, like people can get prone to their addiction, so you should be very um, conscious while prescribing them. In most states and territories, dentists can prescribe a drugs of dependence for a patient under their care, provided whenever you are prescribing a drug of dependence, you should tick all these criteria, which means they do so in accordance with the legal requirements, like the legally you are writing a prescription, and you before prescribing you should ascertain the identity of that person whom you're prescribing, like he's not a drug seeker patient, there is really a therapeutic need for to prescribe this medicine. The drug is required for dental treatment only. Misuse of drugs of dependence, particularly opiates, is increasingly prevalent. Drug dependent and drug seeking patients can present to a dental practice. We all must have seen once or like more times that the drug seeker patient does come to the practice, and what they want is only the particular drug. But we should, before prescribing, we should be very thorough. We should make sure that the need really exists, and as we studied in our last class, that always make a shared decision, and if there is any need, you should make him aware that these medicines would only suppress the effect. The best treatment that he needs is the active dental treatment. Be circumspect if a patient demands drug of dependence and exhibits a good level of knowledge or a preference for a specific drug. When prescribing drugs of dependence, dentists should be familiar with the prescription shopping program, any state-based like before prescribing any drugs of dependence, you should be very thorough with your legislation, your monitoring services, or the prescription shopping program. Legislation about prescribing for staff. Here they have written like a dentist cannot prescribe for staff, family member, and self-prescribing. He cannot do that. Is not recommended. The pharmaceutical benefit schedule includes a number of medicines that, like, for example, whenever you will write a prescription, there is certain boxes that you need to tick, which the PBS medications. Most of the medication are comes under PBS. For example, if it is not subsidized, if it is non PBS, then you should write tick that box that it is non PBS medicine, and the patient will pay the full cost of the medicine. So PBS means that some cost may be paid by the government or the Medicare, but if it is non-PBS, then the full cost may be paid by the patient. If the non-subsidized medicine is a prescription-only medicine, they can be prescribed as a private or non-PBS prescription, and dentists may not order repeat prescription. You should always check the patient again, and then you should write a proper prescription. You should not only write like repeat the prescription. Again, there are some legislative acts and regulation relevant to prescription and prescribing. So these are certain information that they have provided, like for every state there are certain regulations that you need to follow, but it is not very important for this exam purpose. Okay, so tomorrow we will be studying the next pages, which will include the prescription, how to write a prescription, and everything according to that. And I really hope that my videos are helping you. And if you have any doubt or you want me to change any pattern or any idea you have, you can always share in the comment box. And if you really like my videos, then you can always like, share, and subscribe. And you can also write in the comment box. I really feel very good when I see that my videos are helping people. Okay, then see you in next video. Take care.